Whenever I was 6 months old, my mom noticed a knot on my back and decided to take me to the doctor. We went to numerous amount of doctors, and we finally went to MUSC, and they said that it might be a little bit more serious than we thought. So they ran some more tests, and turns out it was neuroblastoma.
Neuroblastoma is one of the deadliest of all childhood cancers. It's a tumor involving what's called the sympathetic nervous system, and it's the most common solid tumor of infancy. Most kids are diagnosed under 5 years of age, and it's a tumor for close to half of the kids where it's already spread, it's already metastatic at the time of diagnosis. And while for most pediatric cancers the overall cure rate is over 80%, for kids with metastatic neuroblastoma, that cure rate has been historically under 40%.
I had cancer. It's not fun. Had to be in a hospital a lot. I had, what was it, Mom?
Chemotherapy?
Chemotherapy. It wasn't fun. I had to be in the hospital for a long time. I had to wear a big Band-Aid around my head. I had to have surgery.
The treatment is very, very aggressive. The kids undergo chemotherapy, surgery, bone marrow transplantation, radiation therapy, and very painful antibody therapy.
I have stage 4 neuroblastoma. It's a kind of cancer. First, I had it in my stomach when I was 3 years old, and then I think I had it in my head right here. And when I did radiation, it kind of made my hair fall out. And now it got in my arm right here when I did radiation. They had to draw dots to make sure to know where it is.
Our goal is also to help develop drugs that have less side effects. A lot of the kids who are long-term survivors, most of them have to use hearing aids because the chemotherapy used affects their hearing. Many have problems with growth. Many from radiation are at risk for developing secondary cancers. They're at risk for developing bone cysts and bone tumors from the radiation therapy. And many kids may be infertile.
Well, radiation isn't really much of a big deal. It doesn't hurt. Radiation is basically just a light they shine on you where you have your cancer, and it makes your cancer go away somehow. But it's really confusing to me because it's just a light shining on you, and I'm like, how could that cure cancer? But when I get chemo, I don't really like chemo because it makes me really, really nauseous and very sleepy. And I feel yucky inside when I get chemo.
How about 3 of 8? How does that make you feel?
3 of 8, I might not be doing it this time for inside my arm, but I did in 3 of 8. It hurts, like seriously, it hurts really, really bad. It gave me a headache. I couldn't even walk because my feet hurt and my back hurt really, really badly, and my arms, my legs hurt really bad.
And one of the places where neuroblastoma can hide is in the bone marrow. And we have to do these bone marrow aspirates and biopsies, for our patients. And we do those routinely about every 3 to 6 months. And I mean, it's a painful procedure. We do it here with conscious sedation, so that they're asleep for it. They don't feel what we're doing. But when they wake up, many times they're groggy. They can't have had anything to eat the night before, and they're going to be sore the next day.
What was it like? And I say I don't remember because I was so young, and whenever I go to get checkups every year, I feel like I meet so many new people that I just kind of fit with them and talk about normal stuff with them while I'm there. So it's not like it's really been affecting me, it's just been creating my personality, so to speak.
Our goal in the lab is a couple of things. One is we're studying these tumors. We're studying why are some forms of neuroblastoma have a cure rate that's over 90%, and why are some have cure rates that are so low. We're working on understanding what makes some neuroblastomas more aggressive than others, and then in collaboration with the basic scientists at MUSC, we're looking at developing new drugs for neuroblastoma.
And my parents were devastated, but they were like, all right, what do we need to do? 2-year treatment, and now I've been cancer-free for about 16 years. So,
a lot of what we're doing is, although we focus on neuroblastoma, many of the things that we're finding in the lab, many of our research, is very applicable for many pediatric cancers. So our goal is to understand the tumor better, to develop new treatments for it, and to reduce side effects for those kids. Our ultimate goal is to find a cure and to improve survival for all those kids.